Hello. For our project, the beta group decided to research undergraduate students here at the University of Oregon. We wanted to analyze the impact that the COVID-19 pandemic had on their mental health as well as their overall educational experience. Now, as undergraduate students ourselves, we recognize the unique challenges that students in the country and across the world have been facing over the past 2 years. So we just wanted to gather more information to be better informed to make the best decisions going into the future.
Okay, so we decided to conduct a survey employing a mixed methods approach to examine the impact of COVID-19 on University of Oregon students. But more specifically, our study focused on the consequences this pandemic has had on UO undergraduate mental health and academic achievement. We assume that the pandemic negatively impacted students' academic performance and mental health due to the abrupt change in lifestyle, in addition to the transitional period associated with this age range. We used snowball sampling, hoping that the people who saw the survey would spread knowledge of it to others, because that would give us a larger sample. To ensure the incorporation of both quantitative and qualitative data, our survey included a combination of multiple choice questions and fill-in-the-blank questions. Our survey consisted of 10 questions total, made sure to include questions regarding years of education, previous school attendance, whether or not they had contracted COVID, living situation, academic habits, and previous experiences with mental health. Finally, we conducted our study by posting it on various social media platforms because it enabled us to reach a larger audience of college students. In addition to the survey, we planned on analyzing data from previous research articles that cover topics consistent with our own, because we hoped this would give us something reliable to compare our data to, as well as offer an additional and or alternative perspective to our study.
Hello, my name is Hunter and I am a part of the beta group, and today I'll be looking at the sampling method. So for our group, we decided to go with cluster sampling. So we divided the large population of students across the nation into a smaller group of U of O students. They represent the wider population and the students of the whole world during the times of COVID-19. They were identified based on the school that they attend to, obviously Oregon, what class they were currently in, and if they attended the university prior to COVID's beginning. It made it easy for us to create an online survey to distribute to these students that what we were looking for as participants. It gave us the ability to take a better look at our student body and the issues that we have been dealing with during these times of COVID and online schooling. We were able to distribute our survey through social media and reach out to these specific research participants that we were looking for. It was important for us to be careful in our sampling to make sure that we were targeting the right research candidates.
The beta group was able to find that nearly 3/4 of students' mental health had been negatively impacted by COVID-19 from the surveys that were collected by various undergraduate students at the University of Oregon. Students reported that group projects have been harder to work with as the ease of scheduling has changed. The way we communicate in a post-COVID world compared to a pre-COVID world reflects the feelings of lost connection and motivation. Learning how to interact again in a non-online world, finding the motivation to go back to school, and retaining relationships are all factors into making the transition into in-person schooling more difficult for one to cope with. With in-person learning present again in universities, students are having a harder time to focus as it was easier to slack off when school is online. Lack of motivation for school has increased as study habits have to adapt to the old ways of learning as more rigorous content is delivered with in-person learning. Connecting back to the research done in similar studies, stress and burnout have been the two most common themes among COVID-19 pandemic. The effects of COVID are impacting students' abilities to learn while increasing stress levels from the amount of change that is happening in the world right now.
Hello, my name is Evan with Group Beta, and I will be discussing the limitations we experienced during our research and any further advice for the future scholars. Our research question only focused on the academic and social impacts of the COVID pandemic on undergraduates in regards to mental health. We hadn't looked into if crime or drug and alcohol use amongst the students had increased during these times. We could have asked more information about the participants' physical health and the impacts the pandemic had on. Our research only focused on the experiences of undergraduates, and we had limited ourselves in getting graduate students and graduate employees' informations as well. The historical time the survey was given and conducted, we were experiencing spikes in the Omicron variant, and some of the professors were skeptical if the in-person lectures would even make it to week 4 of the winter term. I believe that these factors cause limitations within our research. I believe that any future scholars who are thinking of looking into similar fields as we did should try to have more than just one university participating. Only surveying University of Oregon students gave us a picture of U of O students and Oregon residents. One should also look into other states that have different mask mandates, vaccine requirements, and how the varying policies impacted the varying students.